This Dr. Alfred Egedovo of GHC Hospital. Hey everyone, welcome back to our channel. Today we're diving into a topic that's super important but often misunderstood, chest pain. Now before you start panicking, let's break it down. Did you know that not all chest pain is created equal? In fact, there are 4 main types of chest pain, and understanding them could be a game changer for your health. So let's get started. First up, we have cardiac pain. This is the one that usually gets everyone's heart racing, literally. Cardiac pain is often associated with heart conditions like angina or even a heart attack. It typically feels like pressure or tightness in the chest. But here's a question for you. Did you know that women often experience different symptoms than men? Isn't that fascinating? 1. Cardiac chest pain symptoms. Cardiac chest pain is typically described as a squeezing, pressure, heaviness, or tightness in the chest that may radiate to the arms, neck, jaw, or back. It may be accompanied by shortness of breath, nausea, sweating, or lightheadedness. Causes. Cardiac chest pain is often caused by reduced blood flow to the heart muscle due to coronary artery disease, which can lead to a heart attack. Potential underlying conditions: coronary artery disease, heart attack, angina. Example: John, a 55-year-old man with a history of high cholesterol and smoking, experiences sudden chest pain while mowing the lawn. The pain is severe, radiating to his left arm, and is accompanied by sweating and shortness of breath. He recognizes these symptoms as signs of a heart attack and calls for emergency medical help immediately. Next, we have pleuritic pain. This type is related to the lungs and is often sharp and worsens with deep breaths or coughing. It can be caused by conditions like pneumonia or even a pulmonary embolism. But here's a thought: how often do we dismiss a cough as just a cold when it could be something more serious? It's a reminder to listen to our bodies. 4. Respiratory chest pain symptoms. Respiratory chest pain is often described as a sharp stabbing pain that worsens with deep breathing, coughing, or movement. It may be accompanied by shortness of breath, cough, fever, or wheezing. Causes. Respiratory chest pain is commonly caused by conditions such as pneumonia, pleurisy, inflammation of the lining of the lungs, or pulmonary embolism. Potential underlying conditions: pneumonia, pleurisy, pulmonary embolism. Example: Alex, a 25-year-old man, experiences sudden chest pain, shortness of breath, and coughing after a long flight. He seeks medical attention and is diagnosed with a pulmonary embolism, a potentially life-threatening condition that requires immediate treatment with blood thinners. Moving on to the third type, musculoskeletal pain. This is often due to muscle strain or injury and can feel like a dull ache or sharp pain. Ever pulled a muscle while exercising? Yep, that's the kind of pain we're talking about. But here's a controversial question. With so many people working from home, are we seeing an increase in musculoskeletal pain? What do you think? Musculoskeletal chest pain symptoms. Musculoskeletal chest pain is usually sharp, stabbing, or achy and worsens with movement or deep breathing. It may be localized to a specific area of the chest and is often reproducible by pressing on the chest wall. Causes. Musculoskeletal chest pain is commonly caused by muscle strain, rib injury, or inflammation of the cartilage connecting the ribs to the breastbone. Potential underlying conditions: costochondritis, muscle strain, rib fractures. Example: Sarah, a 30-year-old woman, experiences sharp chest pain when she lifts a heavy suitcase. The pain worsens with deep breaths and movement. After ruling out cardiac causes with her doctor, she is diagnosed with a muscle strain and is advised to rest and use ice packs for relief. Finally, we have gastrointestinal pain. This can sometimes mimic heart-related pain and is often caused by issues like acid reflux or gastritis. Have you ever experienced heartburn that felt like a heart attack? It's wild how our bodies can trick us. So what's the takeaway? If you're ever in doubt, don't hesitate to seek medical advice. Better safe than sorry, right? Gastrointestinal chest pain. Symptoms. Gastrointestinal chest pain is often described as a burning or gnawing sensation in the upper abdomen that may radiate to the chest. It can be triggered or worsened by eating, lying down, or bending over. It may be accompanied by acid reflux, bloating, or nausea. Causes. Gastrointestinal chest pain is commonly caused by acid reflux, gastritis, or peptic ulcers. Potential underlying conditions: gastroesophageal reflux disease, GERD, gastritis, peptic ulcers. Example: Maria, a 40-year-old woman, experiences a burning sensation in her chest after eating a spicy meal. The pain worsens when she lies down, and she also notices occasional acid reflux. After consulting with her doctor, she is diagnosed with GERD and given medication to manage her symptoms. It is essential to recognize the type of chest pain you are experiencing and seek medical attention promptly, especially if you have risk factors for heart disease, such as age, smoking, high blood pressure, or diabetes. Ignoring chest pain or delaying treatment can lead to serious complications, including heart attack, stroke, or lung damage. If you are unsure about the cause of your chest pain, do not hesitate to contact a healthcare provider for evaluation and appropriate management. So there you have it. The 4 types of chest pain: cardiac, pleuritic, musculoskeletal, and gastrointestinal. Remember, knowledge is power. If you found this video helpful, give it a thumbs up and subscribe for more health insights. And hey, let us know in the comments. Have you ever experienced any of these types of chest pain? What did you learn from it? Until next time, stay healthy and informed.